Our members are frustrated with the cost of healthcare and insurance. What actions will you propose to improve the healthcare/insurance landscapes for our employers and our employees?
Thank you for that question. That has been, since our first meeting in January of 2015, our goal was to get insurance rates under control. We invested hundreds of $millions to a broken system that was the MNsure or Obamacare that didn't work. It's very expensive. You couldn't see the doctor you wanted to. So we knew we had to make a change. We lost almost all of our for-profit insurance companies out of state. They couldn't stay in business here. So we invested heavily into getting those businesses back into Minnesota. And I'm happy to say that after 4 years of doing several different things to get the for-profit insurance company back in Minnesota, but we also opened up ways that people could start their own group insurance. 40 Square comes to mind. That's for the farmers. They have like $1,000 buy-in, and they're basically self-insured. Drops their rates tremendously, like from $2,500 a month for premium down to maybe $600 or $700 a month. I've been very successful, and I'm also extremely happy to announce that projections for single-payer insurance for 2019 are expected to drop up to about 12.7%. So you'll see 4 major carriers dropping their rates for single-payer health insurance, and that's good news. That means what we've been doing the last 4 years is paying off, and I'm so happy to announce that. And we still have a long ways to go, but you know, we're on the right road. We're basically trying to bring back Minnesota to where it was before Obamacare, and we're on the right track.
The cost for employers and employees in public and private health care is affected by the uninsured rate in Minnesota. Unfortunately, in 2017, 6% of Minnesotans were uninsured. This means they were accessing our hospital and clinics without insurance, and this affects the rates and benefits that we receive in private insurance. We need a comprehensive statewide approach to health care that eliminates our uninsured rate. I support the Minnesota Care buy-in proposal. This proposal would increase a healthy pool of Minnesotans. It would create a healthy pool of Minnesotans paying into a system. When all Minnesotans are insured through private or public options, we will have a strong negotiating position with insurance companies and with providers. We can then work together to work on initiatives that have been started in other states, where the state works with providers to develop rates that apply throughout the state for public and private plans, where goals are made for healthcare systems and providers that the state supports. When all Minnesotans are insured, we will decrease the rates for public, or I should say for private employees and providers.